may be hard to see, what we are looking at in this picture is a molar that is the last molar in the mouth, commonly referred to as the wisdom tooth. What's happening in this case, and usually these are not too painful, but when the infection finally is recognized by the body, it can become very painful. But this is called pericoronitis, and it's extremely painful when the infection sets off. Hello, if you haven't seen one of these videos before, I'm Dr. Eck. I'm a comprehensively trained general dentist. I'm going to be going over this case and kind of talking through what kind of issues there are. More than 90% of people will have a wisdom tooth that just does not come in a way that's healthy for the body. This one just almost made it in. You can see where all the other teeth are at the same level. So that tooth could have come in healthy, but unfortunately, you really need to have a whole space behind your last tooth in order for the gums to grow down around it and not up on top of the tooth. When it's on top of the tooth, you can't clean the back side of the tooth. It's always covered by gums. So at first, your body will rinse it out with its own normal liquids from the body, but eventually this can become very infected. The only way to treat a wisdom tooth infection like this, or the damage, wisdom teeth can cause damage to other teeth just as they come in at a bad angle. This tooth actually is a fairly decent angle for a wisdom tooth, but they cause the same amount of problems when they have the gums covering them. But the only way to treat this kind of infection is to remove the wisdom tooth completely. And that's where you'll see dentists almost preemptively recommending that they take them out. I would say, when I can try to save a wisdom tooth, I would. You want to keep as many wisdom teeth as you can, or as many teeth in your mouth as you possibly can. When it's a case where the tooth just has no space behind it at all and it's stuck up against the back and it causes any infection, you don't want to keep waiting on it and causing problems. Usually, this kind of procedure can be done with just numbing. It's a lot of stretching, so most people will prefer to be asleep when they have their wisdom teeth removed, but there's no reason that you can't have a wisdom tooth removed without being asleep. You can be awake, it just needs to be numbed. In fact, the procedure is so uncomplicated. I just the other Monday had my sister come in and we took care of her wisdom tooth. All of my kids actually got to participate and be little assistants for the procedure. We were able to remove her wisdom teeth. She drove about an hour away because she trusted me and wanted me to take care of her teeth. So she came in from about an hour away. Once we had taken the tooth out, she was able to get in her car with some gauze pressure to keep the sites from opening again. And with the gauze in her mouth, she was able to drive home safely all on her own. Many people get very concerned about the treatment of wisdom tooth and how severe the procedure can be, but in the right hands with the right training, it can be very simple and have very minimal issues afterwards. All of that being said, you do need to make sure that you're very careful when wisdom teeth are taken out. An extracted wisdom tooth is a place that is open and can easily become infected. The way to protect it is by keeping pressure and letting your own body fill the area with its own clots, and the clots can seal the area off. Sucking on straws or swishing our mouth around too hard or exercising and making the blood pump hard can cause us to lose those clots, and that will cause you to have pain afterwards and even infection because you can't keep the infection from getting into those sites. Liquid foods are very important. I always recommend pudding, mashed potatoes, applesauce, jello, yogurt without any chunks in it. Anything that's just a straight paste will not cause any infections in those sites because you can't have pieces falling into it, and the saliva can always dissolve it. But overall, taking care of it in the right hands and having things prepared properly, you can have a wisdom tooth taken out without any major concerns. And you want to do it preemptively because a wisdom tooth can be very difficult to treat if it gets infected. Thank you for watching. If you have any questions, feel free to reach out and ask. If the video would be helpful for somebody, feel free to share it, and thank you for watching. Take care.